Nurse for very many years now, and a community nurse in Hammersmith and Fulham, and a resident of Brent for many years, bringing up my daughter here, and a school governor for John Keeble in Harlesden. So I've really seen a lot of what's been going on there. A lot of things that happen in the world are reflected through that school with the different profiles of the parents and families that come there. So and I see the effect of changes on them too. So community nursing we provide to the most vulnerable in our society, and living in Brent I also was very aware of what was happening to the community services a few years ago in Brent, and it was very harsh and very savage, and they really were only just beginning to recover from that before now we have the next wave, which is even more severe. Obviously I've been very involved in the campaign against the cuts to the A&E departments, so you'll be aware now that 4 of our major A&E departments are scheduled for closure, and you'll also probably know that that is the phase 1, if you like, because once the A&Es go, they will be able to say, well now the rest of the hospital is not cost effective to run, and if it doesn't have a trauma centre you don't need the rest of what they'll be saying is back office. Well actually some of us that need the clinics and other facilities within that hospital still want it to be there. We also want to keep our A&E departments. Now one of the parts of my job, because after being community nurse as a clinical manager, senior clinical manager, and I'm now a senior nurse for the organisation. And every year, part of my job is to look at the winter pressures. So we work with the London Ambulance Service, the acutes, the providers, the commissioners, to make sure that we can offer a service all through the winter because there are more people who do get sicker during the winter months. So it's always been the plan that, or the strategy, that because Imperial has several large hospitals now, St Mary's, which is the nearest to the west A&E for us, when all our 4 close around us, St Mary's would be the next nearest. But every winter, for as long as I can remember, as soon as we get into the winter period, the ambulances are diverted to Charing Cross. Well, Charing Cross A&E isn't going to be there anymore unless our campaign is successful. So, and knowing the other hospitals, south and west, they're not going to cope. They can barely cope now. So, the people who'll be waiting on the trolleys in the corridors, they won't be the kind of people that the Tories are talking about building a better society for. It'll be our friends, relatives, neighbours. So this morning, just to give you a flavour of other things that are going on, so this morning I was on a panel for a tender application process. So bits of our health service and bits of social care are being offered out to the lowest bidder, really, and the fragmentation of that, it's not only that loss of jobs, it's the fragmentation. You cut the health service and social care into bits, and it's never the sum of the parts. It's never going to be as good as all of those services working together. And this afternoon, and even one of the people presenting to try and get the business was saying, well, of course we do understand that what you're really wanting is something that's cheap as chips. And actually we were saying, well, no, actually that isn't what we're looking for. We do want a quality service. So we'll see what they come back with. And then this afternoon I was at one of our NHS nursing homes in Westminster. Now, again, you may know there's a consultation out at the moment. The Westminster Older People's Strategy sounds very good. Lots of people, older people from Westminster are out in other boroughs. They want to bring them back, offer them supported housing in Westminster. That's very good. And that once they're in a supported housing, they will stay there as their needs change for as long as they need it, until they die, preferably dying at home rather than being taken into hospital, if that's their preference. that's all very good, but this isn't going to be an NHS service. Again, it will be offered out, and they are making it very explicit. It will be to the lowest bidder. No question about that. Of course, as a staff side, we've said to management very clearly, we expect them to go for this tender, we expect them to put in a preferable bid so that we can continue to offer this service to the people we already have and future older people of Westminster. And we were told very clearly that whilst the nursing care we may be able to put in a bid for to provide, healthcare assistants, the lower paid workers, there's absolutely no way we will be able to compete. And I just don't understand that, because our low pay are low paid. It's not as if they're paid anything fantastic. Maybe it's because they're talking about they have to add on the pensions. Well, even if a new service does get it, they will have to take our staff, they will have to honour those pensions. But such a defeatist attitude that, well, you know, we're so unlikely to be able to get this service in the future. So we will battle with them to try to make sure we do. But again, it's about cutting up the bits of the health service. It's not going to provide a good future for our older residents. And then I know the other boroughs are all looking at the same things, any possibility to cut the costs. So also, of course, they're trying every possible way of tacking down the paying conditions of staff. And of course, there's in the west, west of England, there are 20 trusts that are in a consortium now to move away from the national terms and conditions. So I won't take much longer, but the other dreadful thing that's happening is, of course, many of you will know there were primary care trusts. All of that now is going over to the GPs to run services or to commission services. So now all the properties in the community that were community services are basically up for sale. And where we say, well, of course, our staff do need offices from which they can go out and provide home care, community nursing, health visiting, obviously school nursing, podiatry, dietetics, specialist nurses, therapy for asthma and chest and diabetes and all the rest of it. Okay, so if you sell those properties and you're only allowed to keep the clinic space, where are the staff going to work when they need to make the calls to the hospital and the GPs and the various other liaison and do everything that they need to do back office to help the patients, keep them out of hospital, which is what the government want and what largely a lot of patients want? No. So they're downsizing the workforce, taking away the properties. Presumably the staff will have to work from home, which has another whole set of problems. There's not the IT, because you have to be so careful about the encryptions and the safety and the security. You can't carry patients' notes around quite correctly. So no one's thought this through. It isn't going to work. So it's only going to get worse. And I think I will probably stop there and be very happy to answer any questions.